Aurora police did not dispatch a mental health worker to a situation over the weekend where a robbery suspect got on an RTD bus with a knife. The man, who was on a work release from a program for people with mental health issues, was eventually shot and killed by officers. We asked about whether Aurora's co-responder program for mental health might have been called in that situation. And that's how our Mark Salinger learned Aurora police don't currently have any mental health responders to send in if they wanted.
Sunday night on Colfax in Aurora saw flashing lights and evidence markers. Police shot and killed a man on an RTD bus who they say was threatening people.
The suspect was reported to be armed with a large knife.
Aurora Police Interim Chief Dan Oates says the man left a work release program for inmates with mental health and substance abuse issues. Officers found him on the bus after he robbed a store. I asked the chief late last night if a clinician with the co-responder program was dispatched to the scene, since the man was coming from a facility dealing with mental health issues.
My understanding is that there was no one with those skills working at the time of this event.
We now know the reason why there was no one working. Because Aurora Police currently doesn't have a single clinician working in the co-responder program that sends an officer and a mental health professional to crime scenes together.
At this exact moment, we have 0 actual co-responding clinicians at the moment.
Courtney Tossan is the Crisis Intervention Programs Manager for the City of Aurora. Clinicians in the co-responder program usually go to calls of all types dealing with mental health issues. Anything from active shooters to trespassing and everything in between. It's important to note we don't know if a clinician would have responded to this scene last night, even if there was anyone working in the program.
Well, there are people that are very interested, but you have to be willing to adequately pay those people and give them benefits that makes this worth it. Because when you go to grad school to be a therapist, you're not exactly expecting to put a bulletproof vest on every day.
Instead, Aurora's mobile response team, which pairs a mental health clinician and a paramedic to respond to nonviolent calls, is picking up some of the dispatches.
That mobile response team is helping and serving as a co-responder team of sorts, where officers are requesting that team to come out and serve more in the co-responder role when they're available and able to.
Fully staffed, the co-responder program has 5 clinicians working in teams with specifically trained police officers. Last year, they responded to more than 1,000 calls, but the team hasn't been fully staffed since 2017 and hasn't had a single clinician for more than a month now. Kyle, now we know why the chief of police told us last night that no clinicians were able to respond.
And certainly we know, Mark, that they're not going to be appropriate in every situation. I thought it was interesting, though, that Chief Oates said to us, well, there just wasn't anybody available. So what are we looking at in terms of a timeline to get these folks hired, and then what happens in the meantime?
Yeah, Aurora says that they're in the middle of finalizing a new contract to hopefully raise pay and benefits for clinicians, though there's no timeline about when employees will be out on the streets and train. You heard Courtney say it herself. Not a lot of people who go to school to be a therapist expect to be putting on bulletproof vests. It's a difficult but important job.
And more communities are talking about the potential for it to save lives. Mark, thank you.